Lifestyle medicine for COVID-19 and NCD care, a wake-up call. This event is proudly supported by the Lifestyle Medicine Global Alliance, the American College of Lifestyle Medicine, the International Board of Lifestyle Medicine, the Department of Health, and the Philippine Medical Association. The Philippine College of Lifestyle Medicine is also supported by several institutions pioneering lifestyle medicine practice in the country. The Remnant Institute Incorporated, a center for lifestyle medicine and education. The Adventist Medical Center, the Four Leaf Lifestyle Medical Group Corporation, the Plated Prescriptions, and the Culinary MD. This event is also made possible through the help of our sponsors, the Pascual Pharma Corporation, the Omron, Simply Nature, and the Foligo.
When accuracy becomes embedded in technology, when medical becomes personal, when life presents zero compromises, that's the sign of the future of healthcare, a future with Omron. Omron is devoted in creating innovative products and services for the benefit of everyone's health, opening possibilities in health management that can be integrated in everyday life. For decades, Omron has made blood pressure measurement at home accessible, designing each device with unique vital sensing technology and rich clinical data to provide the best quality on a global basis. Omron's range of products help people lead healthy and secure lives, conveniently sized, precisely fit, and accurately detecting, whether you're at home or out and about. Omron's state-of-the-art products makes health management easy. They allow people to live a life of zero events, a life with reduced incidence of diseases caused by high blood pressure. Omron has led the advancement of blood pressure monitoring, penetrating the global market as a competitive brand that assures quality and accuracy. Though it took more than 35 years before the first 100 million units of Omron blood pressure monitors to be sold worldwide, 200 million units were sold by 2016. Showing how Omron Healthcare have been rapidly penetrating the global market. Compelled to forge a healthy future for individuals, Omron's monitoring devices are easy to use yet medically accurate, which is why Omron's monitoring devices are likely recommended by doctors here in the Philippines and in various regions. Omron knows the importance of detecting hypertension in its earliest. That is why Omron's blood pressure monitors for home use are designed with innovative features from precise feed cuffs, advanced accuracy technology, to Bluetooth data accumulation. Everybody can monitor their heart health efficiently and know when to be aided medically. Accessibility, quality, accuracy. These are the qualities why Omron's blood pressure monitors are validated by the Philippine Society for Hypertension, showing outstanding results for both past and present models. Omron is available within reach, so everybody can take charge of monitoring their heart health. Everyone can now look forward to a future of personal health management, a future when medical technology has reliable accuracy, a future when medical assistance is just a tap away, a future when life has zero events, zero compromises. This is the Omron future. This is Omron Healthcare.
Our speaker is an assistant professor of the Department of Family Medicine and a clinical science faculty advisory council member at Loma Linda University, where she also finished her residency training in family medicine. She had her fellowship training in geriatric medicine at the University of California, Los Angeles, and her fellowship in primary care psychiatry at the University of California. She also had her fellowship in primary care pain management at the University of California. She is currently the president-elect of the California Academy of Family Physicians. She has published over 20 journal articles including Coping with Imposter Syndrome in the Family Practice Management Journal. She developed the Geriatric Medicine Clerkship Educational Resources for Medical Students in 2020 and the Geriatric Medicine Curriculum Development from August 2018 till the present. She is a Fellow of the American Academy of Family Physicians and received the Physicians Recognition Award in Continuing Medical Education by the American Medical Association. She has extensive community service, research experience, and is active in the academe. She is a board-certified in lifestyle medicine in 2019 and obesity medicine in 2021. Let us all welcome Dr. Ecler Jaqua.
Hello, everyone. My name is Ecler Jaqua. I am a family medicine, lifestyle medicine board certified, and I'm also a geriatric medicine and obesity medicine board certified. I work as assistant professor at Loma Linda University Health. And today I'm going to talk about lifestyle medicine in primary care, a family-oriented approach. So I don't have any financial disclosures or conflict of interest in this presentation. Objectives. Recognize the domains of lifestyle medicine and how they correlate to patient-centered care, create a plan for integrating lifestyle medicine into clinical practice, and apply strategies for lifestyle-related interventions into clinical care. Okay, so I have two questions for you guys. Am I satisfied with my health and my patients' health outcomes with my current practice, or do I see room for improvements? Do I believe that lifestyle change is critical component for me, my staff, and patients' health to improve? If so, am I able to convey that to the patients in my current practice? So I'll just like you guys to just think about it, these questions, and if you are able to, you can share the questions and your answers with your staff and your stakeholders. Okay, so let's start the talk. Globally, approximately 1 in 3 of all adults suffer from multiple chronic conditions. 3 in 5 global deaths are attributed to 4 major non-communicable diseases, which are cardiovascular disease, cancer, chronic lung diseases, and diabetes. Nearly 80% of all chronic diseases are preventable. Lifestyle behaviors are responsible for 40% of all premature deaths. Smoking, physical inactivity, poor diet, and alcohol consumption are among the most common lifestyle factors. Okay, so what is lifestyle medicine? It's the use of evidence-based lifestyle therapeutic interventions, which includes whole food, plant-predominant eating pattern, regular physical activity, restorative sleep, stress management, avoidance of risky substances, and positive social connections. Lifestyle medicine is a primary modality delivered by clinicians trained and certified in this specialty to prevent and treat and often reverse chronic diseases by replacing unhealthy behaviors with healthy ones. Lifestyle interventions are the first-line therapy for treating high blood pressure, hyperlipidemia, and obesity. So lifestyle medicine and primary care. From recommending changes in diet and exercise levels, promoting stress management and other aspects of self-care, lifestyle medicine is an integral practice component for many primary care physicians. While lifestyle medicine is considered a new discipline, it should be viewed as a complement to conventional medical approaches and treatments. Family physicians, primary care physicians are ideally positioned to champion and prescribe lifestyle medicine in the clinic. They can also work collaboratively with community health professionals to help patients sustain healthy behaviors a long term. Okay, so we are going to talk right now about lifestyle medicine domains. So lifestyle medicine applies the medical, behavior, environmental, and motivational principles to prevent, treat, and reverse chronic conditions like we spoke before. It focuses on 5 main domains, which they are connectedness, movement, nutrition, recovery, and substance abuse. When addressing all the domains together, lifestyle medicine can address multiple chronic diseases at the same time. So let's talk now one by one. We are going to start with connectedness. So connection, relationships, and purpose give meaning to life. The domain is central to lifestyle medicine, as it helps patients identify motivations and changing the motivations to change their lifestyle. That's why on that figure, connectors is in the center, because we need to find that connection to make the change. Being lonely, especially among older adults, actually is associated with increased risk of heart disease, stroke, dementia, depression, anxiety, suicide, and increase the rate of hospitalizations. The connectedness domain focuses on relationships that individuals have with themselves, family and friends, community, nature, and a higher power. Studies have shown that people who practice religion or spirituality have improved mental health and are able to adapt more quickly to health problems. Now let's talk about movement. Lack of movement is one of the leading risk factors to many chronic diseases. The 2018 physical activity guidelines actually encourages all adults to get 150 to 300 minutes of moderate intensity aerobic physical activity per week, or 75 to 150 of vigorous intensity physical activity. Or you can do a combination of both per week. It's also recommended at least 2 full body strength training sessions per week that should be performed on at least on your major muscle groups. If an individual with chronic conditions or disability are unable to achieve the recommended guidelines, they should be as active as they can. Little activity is going to improve a lot their chronic conditions. Now let's talk about nutrition. Unhealthy diet may have actually overtaken tobacco use as the leading cause of premature death. An optimal diet is still an area of frequent review. We still don't know what is the optimal diet, but a healthy diet should focus on whole, minimally processed food and vegetable consumption. Reducing or eliminating all sugar-sweet beverages, very, very helpful too. Recovery. So recovery is the body ability to rejuvenate and recharge itself. So recovery can be associated with sleep and also stress. So we are going to talk mainly on this slide about sleep. So sleep has a significant impact on health, including chronic diseases development. Sleep may play a vital role in metabolic regulation, emotional regulation, performance, memory consolidation, and learning. The amount of sleep each person needs varies, but the American Academy of Sleep Medicine and the CDC, which is the Center for Disease Control and Prevention, they recommend an average of 7 to 9 hours of sleep per night for all adults and 8 to 10 for adolescents. Stress. Stress impacts every other domain. It is not necessarily the amount of stress, but rather the capacity to manage well the stress. Susceptibility to stress depends on genetic vulnerability, coping style, personality type, and social support. Short-term stress actually can boost your immune system, but chronic stress can increase the susceptibility to several of chronic diseases, like diabetes, cancer, cardiovascular diseases, depression, autoimmune disease, like we mentioned before. Identifying and connecting the patients with more stress is going to help them, is going to impact their physical and mental health. We need to recognize and refer or treat them as soon as possible. Substance abuse. So 35 million people worldwide suffer from uncontrolled use of a substance such as tobacco, alcohol, or illicit drugs. Substance use disorder has a higher risk of morbidity and mortality, as we know. Substance abuse use disorder is often the manifestation of actually underlying stress, anxiety, depression, or any other mental health issue that was not that has not been adequately addressed or treated. Rather than focusing on discouraging the use of these substances, lifestyle medicine seeks the why and the what. The why patients want these substances and what is the benefit that they get from that. So we go and we try to find the root of the issue, of the cause. Okay. So now we're just going to switch gears a little bit. Incorporate lifestyle medicine into your practice. So we require support and effort from different staff levels within and outside your practice. This could include individuals on your clinical care team, practice or health system leadership, information technology staff, and administrative employees. So basically now what we're going to talk is how to build a leadership plan to incorporate, do the changes that you want, incorporating the lifestyle medicine into your practice. So this is a very nice graph, and that's what we are going to talk about: vision for lifestyle, how we can gather the wins and success and build a correlation. Okay. So a sense of urgency is very actually necessary to create motivation and energy needed to create the change. Individuals experience a sense of urgency when they feel that the status quo is basically not sustainable anymore, and that working towards the change will benefit them, their patients, and their organization. This requires a balance. So this requires a balance between helping the practice stakeholders to recognize the need for change, to incorporate lifestyle medicine, and also the feeling of being comfortable working towards this goal. So you have to have that balance to recognize and also to be comfortable, recognize the issue and be comfortable with the change. When creating a vision statement, which is actually very important, the vision statement should be easy to communicate, feasible, emotional appealing, and strategically aligned with your practice mission. It may highlight the improvements on your patient's health, improvement in cost saving, and also improvement on your health system quality metrics. I think that's important to address and to show, especially if you have examples of how we can improve and change that also in your organization. Building a strong correlation. That's another topic too that is very important. So first thing that we need to do is to establish a team to guide the lifestyle medicine change initiative, right? So that's what we are going to do. We are going to try to implement the lifestyle medicine into our practice. So we need to create a team, and this team should include individuals most excited and engaged in making a change. Ideally, this team is supposed to is led by a physician that is certified in lifestyle medicine, or at least is very interested in the topic. And also we should have clinical staff champion like a medical assistant or a nurse, and administrative champion like office manager. So it's very important to integrate both clinical and non-clinical members to help improve engagement at all levels of the practice. The guiding team would be responsible for engaging and educating the staff, assessing the practice, implementing the changes, and by evaluating the success and opportunities for change. Also, along the build a strong coalition topic, we need to communicate our vision for change and empower and engage the stakeholders to do something, to act. So the team should deliver the message in a memorable, creative, authentic way to gather everybody's attention. Barriers should be removed, at least at this time, to empower people to act. Creating a lifestyle medicine culture requires physicians and other clinical staff to discuss the positive impact healthy lifestyle changes happen on patients' life. So if you have an example of a patient that was able to do the lifestyle changes and they got better with their disease, with the diabetes, the high blood pressure, that's a very good time to bring this example. It is necessary also to communicate a clear and consistent message to all relevant stakeholders, including practice staff and patients. Here on the last bullet, it says, build a culture focused on teaching and modeling lifestyle behaviors. So what that means is basically give the example and apply that to our own practice. For example, 5 minutes lifestyle medicine tips on a staff meeting, host healthy office lunches and healthy snacks, group walks during lunch. That's what we do in our clinic. It's very helpful. After you have a healthy lunch, you just go together with your friends to do a walk, or just challenges like who was able to do more steps or lose more weight. So that's very helpful to motivate the members on your clinic. So celebrate success and institutionalize the process. So basically, it is essential here to have some successes, right, during the change process. And it could be very, very small ones, right? Like, for example, changing the practice aesthetics to be more like lifestyle friendly, or incorporating like physical activity vital signs during the visit. And with over time, of course, these successes could be bigger, right? Such as implementing lifestyle medicine assessment forms into the office templates. And with that, you need to train the staff to make sure they teach the patients how to fill out the forms and how to place the forms and make sure they use the right templates. One effective tool to do that, these small changes, is the PDSA cycle, which is the Plan, Do, Study, Act. So this approach basically empowers stakeholders to provide input and rapid feedback before doing the implementation. So this cycle should be focused on a very, very specific change, usually is small, and is supposed to be very rapid, not more than 3 months. And the goal is to keep doing this small PDSA cycles and working until the lifestyle medicine is entirely incorporated into everyday practice. Incorporating lifestyle medicine in clinical care. So the foundation of lifestyle medicine's efficacy is the ability to facilitate patients' behavior change. So what do we use for that? We use the stage of change model, which is the most used behavior change framework. The goal is for the individual to incorporate their behavior into daily life without having a continuous assistance in maintenance of this behavior. However, relapses can happen, and it's very important to provide consistent motivation and support over the time, all the time of the change, to minimize any setbacks. Various team members are going to be included on this change, and they may play different roles during all these stages of change. The purpose of a team effort is to share goals, clear roles, mutual trust, and effective communication for these changes to work for our organization and for our patient's life as well. Okay, so now we're going to talk about each stage of behavior change, and we are going to start with the pre-contemplation. So pre-contemplation is basically the patient not ready, not engaged, and has no intention for lifestyle changes, not ready yet. And this could apply to your practice too. So what we are supposed to do? Assess the barriers limiting the patient to make the lifestyle changes. So what is going on? What is your motivation, or maybe lack of knowledge? That's what we could act and maybe give that knowledge and motivation for the patient, or find the motivation that is missing there, and act as an advocate for the patient to overcome barriers. We're not there to tell them what to do. We're just there like if they need us, and we are helping them to just fill these gaps. Contemplation. So the patient is not practicing any change now, but is committed to do it soon. So what we can do here, we can increase the patient awareness of their current behavior pattern. So this can help, and maybe is the push for the patient to move for the next stage, which is preparation. So preparation is basically the patient is taking some steps towards a change. And again, this can include our practice too, like the steps towards the change, to make the change, to incorporate lifestyle medicine in our practice. So this is just a patient example. So patients taking some steps, like for example, joining a gym, right? Maybe not started the exercises yet, but they already joined the gym. So that's a good start. So what we're supposed to do as doctors, healthcare professionals, to develop an action plan, help the patient to connect with the exercises, classes, and community resources, right? So, okay, you're already there. So how can we make this happen, right? And educate the patient. Action. So action, patient is basically doing, right? So patient is in action, doing something, change the diet, doing some exercise, right? So already doing some behavioral change, quitting smoking. So this part is very important because we need to keep having close follow-ups, regular education, keep the track of the progress, and just show them the success, all the improvement that they are doing. Maintenance. So maintenance, patient is maintaining, patient is doing great. I passed my action phase, more than 6 months. I'm able to give my lifestyle changes. Very, very important from us to ensure the consistency, regular follow-up to avoid relapses. That part is very important because now we need to make sure it's sustainable. And the last one is relapse. So relapse, like we talked before, it can happen. So basically the patient is failing to maintain a routine and falling back into previous behavior, which is okay. It can happen, but that's why we need to be there with them and find out the reason for relapse and create a new action plan, right? So what happened? You did so great. We are here to help you. Maybe we need a new action plan because the one that we started is not working. Or something on the action plan was not working. Maybe the beginning was not, but it was not sustainable. So we just need to find the right approach for each patient. Good. So we are getting to the end of our talk. So I just would like to talk about some tools that we can use for our patients, for our staff. So effectively practicing lifestyle medicine actually requires understanding of each lifestyle medicine area and assessing behavior change across all the domains that we talk about. So this assessment is basically a comprehensive assessment in lifestyle medicine. So we call it as a screening tool, but is the main one. So it consists of 21 items, and they screen for healthy behaviors across all lifestyle medicine domains. Connectedness, like we talk about, nutrition, movement, recovery, and substance abuse. Individuals can earn up to 10 points for each domain with a possible of 50 points, 50 for the entire assessment. The lower the score, the more opportunity to improve patient health through lifestyle behavior change. So if the score is low, that's your opportunity to try to help with the lifestyle medicine change. The tool can quickly identify areas of success that should, of course, be endorsed, right? Like, hey, you're doing so great on this domain, on this area of lifestyle medicine. But we also can see the weak areas that we can offer some additional assistance. So this is going to be, this lifestyle medicine screen tool is very helpful, like I said, for your patients, for your staff, for your clinic. It's from the AFP and is available on your handout. And also on your handout, I added additional assessments. This is the biggest one, the main one, but additional small ones, small assessment tools of each lifestyle domain, also from AFP, that could be helpful, especially if there's one of the domains here that you are able to see on the main assessment is more on the weak side. You are able to use a specific tool for that domain. Conclusion: changing behavior can be challenging for everyone. However, incorporating lifestyle medicine into your practice can make a difference in your team and patients' health. And this change can be the first step for you to build a healthier community and healthier patients. These are my references. If you have any questions, I'm happy to answer them through the chat. And thank you so much for the invitation. I hope you guys have a wonderful day.
Lifestyle medicine for COVID-19 and NCD care, a wake-up call.
Our gut is home to trillions of living microorganisms. In order to live, multiply, and perform their functions, they need to be fed sufficiently. Or else, they'll look for other sources of food within our body, which will eventually make us sick. Fruits and vegetables contain prebiotics, such as fructooligosaccharides, the right food for our gut bacteria. However, proper amount may not be acquired through natural food only. Hence, supplementation is needed too. Foligo is an all-purpose prebiotic powder that can be added to commonly consumed food and drinks, hot or cold. Each sachet contains significant amount of pure and highly concentrated fructooligosaccharides for prebiotic supplementation. Fructooligosaccharides are generally recognized as safe and has been proven to promote growth of beneficial microbes in our gut, resulting to healthy digestion, absorption, and elimination of food. Additionally, it enhances production of metabolites that are beneficial not only to the gastrointestinal tract, but also to distant organs and body systems. A well-fed gut will also improve immunity and decrease the risk of allergy, reducing the overall risk for a wide array of chronic diseases. Feed your gut with Foligo.